My name is Angelina Ireland. I'm the president of the board of the Delta Hospice Society. I came to the society 7 years ago as a cancer patient and utilized the support services offered by the society. I was very fortunate to recover to good health. I am like every other person involved in the Delta Hospice Society. We give it our heart, our time, and our energy. Some of the friends I met in treatment did not recover and ended up passing away inside of this hospice. It is for the people like them who came before us and those that will come after us that we have fought for the past 12 months to keep euthanasia out of this hospice. Today, the Delta Hospice Society has been forced to issue layoff notices to our clinical staff prior to us being pushed out of our own hospice. We must inform them that we will no longer be their employer effective February 24th, 2021. The board of the Delta Hospice Society deeply regrets being compelled to take this action. Tragically, we have been left no other choice due to the cancellation of our service agreement and our 35-year lease, having 25 years remaining with the Fraser Health Authority. We are about to be evicted and approximately $15 million in assets expropriated simply because we declined to provide medical assistance in dying, otherwise known as MAID, at our 10-bed Irene Thomas Hospice in Ladner, British Columbia. To be absolutely clear, we are not opposing the provision of MAID in the BC healthcare system. We accept that MAID is a legal service across Canada. However, nothing in Canadian law requires medically assisted death to be made available everywhere, anytime, to everyone. The constitution of our society and our commitment to palliative care bars us from offering it. Neither the board of the Delta Hospice Society, the vast majority of our patients and our members want to change that. This is not a debate about MAID. A person who wants MAID can have it at the hospital next door to us. This is about the BC government destroying a sanctuary for dying patients who want the choice to stay in a facility where MAID is not offered. They now find their rights to equal choice and representation revoked. They are being disenfranchised by the very system that they pay for. We at the Delta Hospice Society are committed to protecting the right to a sanctuary for equal choice at the end of life. We offered to forego $750,000 in public funding last February in order to operate as an authentic palliative care center. The Fraser Health Authority rejected the proposal without negotiation. Instead, it served us with what amounts to a 1-year notice of eviction. The Society has done all it can to have discussions with Fraser Health and provide creative solutions. It has done all it can to follow its service agreement and the required legislation. Fraser Health has made no attempt to remedy the breach in the 30-year relationship with our society. We have always been recognized for our exemplary care. We now ask journalists, legislators, senators, and the Canadian people themselves to recognize and demand sanctuaries for the dying, places where people can feel safe in their final days, where MAID will not be suggested to them, where MAID will not be administered to them, and where their freedom as a citizen of this country is respected. Today, we call for hospice sanctuary. Thank you.
Thank you, Angelina. My name is Danielle Martell, and I am the Vice President of the Delta Hospice Society. This has been a weighty issue weighing on our hearts, and we are very disappointed about what has taken place. And now I would like to take the opportunity to open up the discussion for many of our palliative care professionals that are here with us today. And how about I pass the floor to Dr. Will Johnston, who is with us now.
Thanks very much, Danielle. I had a patient who went into a hospice 2 years ago, and she had no intention of asking for euthanasia. She was hoping to live the remaining days of her life as fully as she possibly could. And within days of arriving at the hospice, she was pressured into signing a request for euthanasia, which was going to happen 4 days later. On that day, or shortly after that day, her brother arrived from Australia and was horrified to find out that she had signed papers. He questioned her further. He reminded her that there'd be no time for other family members to come and see her. He was there at the right time. She changed her mind, and she had another month of life where she was able to really finish some important family business emotionally, and had a very good dying process in the natural way that palliative care was always meant to provide. What is happening to Delta Hospital is absolutely outrageous. I've never seen such an obviously unfair and unjust attack on a volunteer society in any field in this country. Here we have thousands of volunteer hours and millions of private donations that went to create a space dedicated to the foundational principles of palliative care, involving no intentional killing of the patient and no threat that the patient would be steered in that direction by someone who is euthanasia minded. I think that Fraser Health needs to deeply rethink the bullying tactics and the completely unjust process which has led to the effective expropriation of this privately funded public benefit, where the vast majority of people who have no interest in having anything to do with euthanasia can be absolutely convinced and safe in their trust of the classic palliative care principles, which involve living as fully as you can until dying of a natural death. And I call on the provincial government to look into what this rogue health authority is doing to the whole concept of the immensely important business of private donations and private volunteer involvement in our healthcare system. Thank you, Danielle.
Thank you, Dr. Johnston. Now, Dr. Neil Hilliard, you're a palliative care physician, and you were formerly the program medical director for the palliative care program at Fraser Health Authority. I wonder if you would be willing to speak to this issue also.
Yes, actually, this is the issue that I resigned about in December of 2017, that hospices be forced to provide physician hastened death or medical assistance in dying. And I continue to support the Delta Hospice Society to stand by their principles of palliative care, and what hospices have always done well, which is to help people to live well until they die. We know that only 5% at most of Canadians wish medical assistance in dying. 95% do not. They value the care that is provided in a hospice. And so it makes me wonder why the province of BC has taken this particular action of forcing a hospice against their principles to provide physician hastened death. As far as I know, at least at the time that I resigned, the province of BC was the only province that was doing this in Canada. So my question to those that are viewing this is, what would you want for yourself, and what would you want for your loved ones if you're one of the 95% at the end of life?
Thank you, Dr. Hilliard. Dr. Margaret Cottle, what's your initial reaction to this? I know you're also a palliative care physician in Vancouver.
Yes, excuse me. I've been caring for people at the end of life, doing palliative care now for over 3 decades. And this is an issue that's very near and dear to my heart. The early days of palliative care, we spent a lot of time talking to patients, talking to our colleagues, saying, no, we are not Dr. Death. Palliative care does not hasten or prolong natural death. That's one of the basic principles. As the other 2 physicians have said, we want to help you live well, live symptom-free, live as you would want to live until your natural death. And we need places like the Delta Hospice where your worst day is not going to be your last day. Some of this situation is really disturbing because the Speaker of the House of the previous legislature, Darryl Plecas, who did a white paper about what should happen with hospices in the province of British Columbia. And it was done very well, it was unbiased. And what he suggested was that hospices that were paid for fully by the health authority should do whatever the health authority said. But hospices that were partially independent or completely independent should be allowed to follow the dictates of their board and their constitutions. And that would mean that the Delta Hospice could remain a sanctuary for people who did not want to have anything to do with euthanasia, either for themselves or to have their families exposed to it when they were there. So the government completely sidestepped that and just is doing what Dr. Johnston said is really a bullying tactic. Now, I think about this myself, and I think if I come to the end of my life and I'm in a position where I am desperate for some reason, I've lost hope, maybe I'm having some symptoms that we're having trouble getting under control, but we can always get them under control at some point, but maybe it's a bad day for me. I want to be sure that I'm in a place that won't take me at my word when I say I just want to die. I want to be in a place where people will love me, who will come alongside me, who will provide hope for me and say, what's the worst part of this for you? How can we help you? How can we reframe hope for you? How can we help you control your symptoms? How can we help you come together with your family? That's what this is all about. It's not about rights. Rights are an admission that love has failed. This is about loving each other. This is about what it means to be a Canadian, to care for each other, even when it's hard.
Thank you, Dr. Cottle. You raised some really important points for us to ponder. Dr. Leiva, I'd really like to turn to you now. You're a family physician in Ottawa, and you're also involved in palliative care as a co-specialty, and you're an author and a speaker. I wonder if you would like to contribute to this conversation also, please.
Yes, I would like to add briefly, because you have already, the previous speaker have said wonderful things, is that I have done some research and looking at other jurisdictions, including in Canada. And I have to be extremely clear that this is very unusual for a government to do that. It's in fact totalitarian. In Canada, whether its institution is religious or is not religious, they have granted the freedom to do that. Even not necessarily conservative governments, but other governments, such as Quebec government, has allowed institutions to practice according to their principles. Just an example, across the bay from Vancouver, if you move to the States, the Affordable Care Act, also known popularly as Obamacare, has a specifically clause that protects the right of institutions to practice and not to perform euthanasia within their walls. So therefore, I think what the government is doing is that it's failing to provide reasonable accommodation, especially when you have a hospital across the street that could certainly accommodate any request of any patient requesting made. I will implore and in some degree demand the government to live by Canadian principles and to protect the right of Delta Hospice to practice according to their principles. Thank you.
Thank you. And Alex Schadenberg, you're the Executive Director of the Euthanasia Prevention Coalition in London, Ontario. And you guys have been working on prevention of euthanasia for a long time. I wonder what you would like to say in response to this issue.
Well, the situation with the Delta Hospice is very much of a problem, because when Canada legalized euthanasia in June of 2016, nothing in the law required every publicly funded medical facility to provide MAID, euthanasia-assisted suicide. It was the BC government that established this policy. So this policy does not exist throughout Canada. This is a BC policy. And this, of course, is a situation where I very clearly see that the BC government policy discriminates against people who want to be cared for in a euthanasia-free environment. For instance, the Delta Hospice operates the Irene Thomas Hospice, which is located literally across the street from the local hospital, as has been said. So this isn't an issue of denying people the option of a legal option or anything like that. This is a situation where they're pressuring or forcing every institution to do as their policy dictates. People who want to receive excellent care and die a natural death without fear of being urged to consider euthanasia have been able to go to the Delta Hospice Society, to the Irene Thomas Hospice. But after February 24th, there will be no free space, safe space in the Delta Hospice region. It'll be gone. I want to tell you also that as the Executive Director of the Euthanasia Prevention Coalition, we receive many phone calls from people who are concerned when they're receiving medical care or a family member receiving medical care, and they have said, my mother, my brother, my friend felt pressured to ask for euthanasia. So if you're thinking that this is something that doesn't happen, in fact, it has been happening, and many people are concerned about this pressure upon them, especially at their time of need. We have to also consider the fact that we are human people, and what makes us human is the fact that we have emotions, that we are affected by our situation. And so therefore, I have a great concern for people who oppose euthanasia, but at their time of need, sometimes they become very depressed. They're human. They're experiencing these deep transient feelings of hopelessness or despair, and they might request euthanasia, not because they're seeking it, but because they've become so darkened. They've gone to this dark place in their life. And this is what some people experience. We need a safe place to die. I need a safe place to die. This concern recognizes the humanity of the person, because we all experience these times to different degrees when we feel that our life lacks purpose, our life lacks value or meaning. And yet we know that with time and good community care like the Delta Hospice can provide, that we can die a natural death properly cared for. So we need safe places. This is what we need. We need places like the Delta Hospice Society, that the Delta Hospice Society is worth fighting for, and what the BC government is doing is discrimination.
Thank you, Alex. That's very helpful. I would like to thank everyone for joining us today and for contributing so thoughtfully. We really appreciate your time and the privilege of having these healthcare professionals with us and such thought-provoking things for us to think about. Angelina, I wonder if there's anything else that you would like to say before we all sign off.
Thank you so much for being with us today, our friends. And I just want to say that we all must recognize that palliative care is a national treasure. It is the perfect kind of care for a country like Canada, full of compassionate and loving people. It is a gift to humanity that needs to be protected. And, furthermore, we would like people to join us because we are not finished. We are a society that has gone national in our quest for hospice sanctuary and safe spaces in this country. So I want you to go to www.savedeltahospice.com. I ask you to become a member. Together, we will be thousands strong to put a lobby to legislators and to senators and to protect some of the greatest things that we've created in this country. So thank you for being with us. And the fight is not over. The fight has just begun.
Thank you.